In the interest of some scheduling issues with two of our public comments, I'm going to invite a couple people who wanted to come up and talk on pneumococcal meningitis to come forward. We have first Robin Capert from Copley, Ohio, and then followed by Tresh Carnell and from Vancouver, Washington. So if Robin Capert can come on up. Thank you.
Hi, my name is Robin, and this is my husband Keith and my son Gregory. I wanted to start off we also have a daughter at home, a younger daughter, and I would like to start off reading a paper that she had wrote for school recently. And the assignment was about a formula. If you could write a formula, what would it be? And I'm going to read a shortened version of her paper. And this is the third grade response with no help from any of us. She nailed many of what we are dealing with Gregory on a daily basis. I seek a formula that will make my big brother able to walk. Gregory was diagnosed with meningitis when he was a baby. Gregory is in a motorized wheelchair. Gregory needs braces on his arms and AFOs on his legs and feet. Gregory plays soccer for kids with disabilities. He is the only one in a gay trainer. Gregory and I have a cat named Oliver and a dog named Apollo. Greg is fun, funny, sweet, and kind. Gregory would have seizures when he's sick. If Gregory could walk, he could pet Apollo and Oliver like the rest of us. He could feed himself with no help. It would be much easier for my dad to get him up and down the stairs. He can have fun with me in the sandbox. He would be able to give me a hug by himself. He can play more games with my friends than I instead of sitting with his parents. If it works, I hope for all kids with disabilities to be able to walk. I hope that Gregory can walk soon. There was a shortage of the vaccine, and my son was not able to get the vaccine, the booster, and he developed pneumococcal meningitis. And as a result, he had he suffered brain infarct with a traumatic brain injury. And as a result of that, his diagnosis is spastic quadripartite. He has a seizure disorder, dystonia, a learning disability, speech delay, and he's unable to take care of himself, and he needs one-on-one aid to do simple tasks, feeding himself, dressing. He wears a diaper. He's not potty trained, so someone has to change his diaper, and he's unable to sit up, unsupported, and unable to walk. The financial responsibility we've had since he's been sick. He has anti-seizure meds, $800 a month. He's going to have ongoing therapy for the rest of his life, about $2,000 a month. He has to get annual AFOs and braces because he's growing every year. His motorized wheelchair was $20,000. The accessible van to do the conversion, another $25,000. We have spent almost $500,000 in his medical expense since he's been sick with meningitis. My husband and I are both on employers' insurance, and we've maximized out-of-pocket expense every year. This could all have been prevented if Gregory had received his booster. Think of how many boosters we can save by administering the booster with the $500,000 we spent on him. I am pleading with all of you to not change the dosing schedule, as we may have more like Gregory, or we'll even die. Thank you.
Thank you very much for your comment. If you wish to leave the copy with the desk in the back, we will be happy to distribute it to all the members here. And then if we can ask Tresh Carnell if she is here.
Hi, everybody. My name is Tresh Carnell. I'm with PKids, Parents of Kids with Infectious Diseases. It is really nice to see so many familiar faces around the table. I made notes because I'm going to be talking numbers, and I want to make sure I'm accurate, so I will try not to read too much, but I will be referencing the notes. So last summer, I read an article in Pediatrics that looked at the cost effectiveness of using 2 rather than 3 primary doses of 13-valent pneumococcal conjugate. And I scanned down to the results, and when I saw those numbers at the bottom of the results, I thought, well, this is an intellectual exercise. It's a study. Interesting, but it's, they're not going to do anything with it. And then we saw that ACIP put it on the agenda last time you met. And I should say that I have a lot of empathy for what you go through when you have to make your decisions. I know it's not an off-the-cuff kind of thing. Your working groups do work very hard. Your deliberative process is thorough. And I truly appreciate that. So I want to put that out there before I get into this. So anyway, you did put it on the agenda, and we thought, okay. So we asked Shannon Duffy to come and speak to you and share her experience. She lost Abigail to pneumococcal. And that's what we do as advocates, is we try to put personal faces onto preventable diseases to help people understand that this is happening in the United States, and it is important that, you follow the recommendations of the ACIP and you get vaccinated. So we thought that would probably be it. You all, that it was on the agenda, but then you put it on the agenda again. And so I wanted to come in because those numbers, I can't get past those numbers at the end of this study. And we talked about it at PKids, and we didn't really think that the study would go anywhere because, well, it's our tradition in the U.S. to use all of our tools at hand to protect our citizens, our kids, our adults, and of course, vaccines are definitely a preventive tool. But it seems that, and I hope I'm misreading the situation, that we're here looking at this as a possible option. So if a primary dose is removed, we have an opportunity to save money, big money, $500 million maybe. But it's not a risk-free deal. In order to save that money, we believe at PKids that we have to be willing to see harm come to some of our people in the United States. And this just flies in the face of what we as immunization advocates say every day to the people that we meet, which is get immunized. Use the safe and effective vaccines that we have to prevent infections. So it's easier, I think, to make this kind of decision and to talk about the numbers of the folks who will be harmed if it's not personal. They're just numbers. But as goes ACIP, so goes the nation when it comes to immunization. Therefore, we have to consider the personal side of this decision. We can't dehumanize our people, our loved ones, our friends, our children, our neighbors, by thinking of them only as numbers. If the 3rd primary dose is removed, an average of 2.5 more people will die each year. So who are these people? I have a little niece named Millie who's just learning to crawl. She could be one of those 2.5 people. Your son or grandson who's just getting into Cheerios and bananas could be the other one this year. 44 more people will get invasive pneumococcal disease. My daughter could get meningitis, and your son could get a bloodstream infection. 1,500 more people will be hospitalized for pneumonia. When my oldest, Paris, was a toddler, she was hospitalized for pneumonia. It is a terrifying experience, and one that I wouldn't have anyone else go through if it's possible to prevent it. An additional 10,000 of our friends and neighbors and loved ones will have to be treated for pneumonia as outpatients. 2,300 more ear tubes will have to go into little kids' ears, and a staggering 261,000 more kids will get earaches, fevers, and possibly ruptured eardrums. These were the numbers at the end of this study. That's why I had to write them down. All of this happens if we decide to save money and remove a primary dose. It's all about the numbers. We just have to decide which numbers are more important to us as a nation, the dollar amounts or our people. Thank you so much.
Thank you.